The invisible enemy doesn't attack your physical health alone. It takes a toll on your mental well-being as well. Experts across the globe have conducted detailed research studies to show the impact the pandemic is having on our mental being. And this is an epidemic of monumental proportions because the amount of death and devastation we're having to process is unnatural. Nobody ever needs to deal with so much death and devastation. And yet, whether you're a journalist or whether you're in a hospital or whether you're just sitting back on your phone doom scrolling, you realize that what you're seeing is taking a toll on you, and that toll by itself can be devastating.
Sleepless nights, increased anxiety, loss of appetite, and frequent occurrence of nightmares. If this is what you are facing in your daily life in these corona times, then it is time to assess your mental well-being. Experts across the globe have raised concerns over the psychological impact on people locked in their houses due to the pandemic. Experts at Britain's Oxford University suggest at least 7% of COVID patients admitted to ICUs suffered a stroke within 6 months. Lancet Psychiatry Journal analysed health records of over 236,000 COVID patients. At least 34% patients witnessed psychiatric diseases of one or the other kind within 6 months. According to University College London researchers, people with cancelled appointments and no face-to-face help felt that they were missing out on care, which further affected their mental health. Doctors across the board are going out of the way to ensure patients' mental well-being apart from curing their COVID.
जितना पैनिक होता है दुनिया में उतना ही ज़्यादा और परेशानी बढ़ती जा रही है। हम यहाँ पे सबको काउंसिल करते हैं, सबके लिए कुछ गेम्स अरेंज करते हैं कि थोड़ा थोड़ा इनका मन के इनको पूरा हर वक्त बताते हैं कि सब कुछ ठीक है, ठीक हो रहे हैं, पूरा आश्वासन देते हैं ताकि जो ज़्यादा ऑक्सीजन पे हैं वो भी ना घबराएं। घबराने से कई लोग इतना पैनिक कर जाते हैं कि उनकी तबीयत ठीक होते हुए भी ज़्यादा खराब हो जाती है।
Health experts explain how one can beat the stress attached to COVID times.
To deal with it, have a healthy lifestyle. Ensure your sleep is proper. Take some me time. Do some yoga exercises. It will give you the confidence that I am taking precautions as much as I can. Stay connected with family. Stay connected with friends. Keep talking. Unmute yourself. Don't keep things bottled up. And if you are struggling, reach out to someone.
Several citizens have already taken the necessary steps to beat the mental strain caused by the invisible enemy.
Since the beginning of the pandemic, there has been a 20% increase in telepsychiatric consultations in India, and face-to-face consultations, though, have plateaued. This is a good sign because it shows that there is an acknowledgement and understanding that there indeed is a problem. Seeking help is good. What we do not have control over is the pandemic. But what we can have a control over is how we work our way around this pandemic. In New Delhi, Sneha Mordani for India Today.
You saw in that report, 34% of those who've been through COVID are experiencing mental health issues. And even if you haven't been through the infection itself, just seeing the death and devastation around you is taking a huge mental toll on every one of us. Some of us are cognizant of the impact this is having on our mental health. Some don't realize it, and some are just sinking without even knowing that they're sinking into a hole. To talk about how best to deal with the mental health issues that the COVID pandemic has thrown up, I'm joined on this broadcast by a very distinguished panel. I want to welcome first Dr. Vikram Patel, Professor of Global Health at the Harvard Business School, at the Harvard Medical School. We have Dr. Sameer Parekh, psychiatrist and director of the Department of Mental Health and Behavioral Sciences, Fortis Healthcare. We have Dr. Amit Sen, child and adolescent psychiatrist, and Dr. Bhavna Burmi, child and clinical psychologist. I want to go across to Dr. Patel first. Can you explain what you're picking up? First, let's just talk about the problem itself. and everything that you're seeing around you, hearing people who are talking to you. Explain, Professor Patel, what is it that you're picking up about the kind of impact the second round of COVID infections is having on the mental health of Indians?
Well, thanks first of all for taking up this really important subject at this extremely harrowing time in India. I think it would be fair to say that what India is experiencing on a scale probably never seen before is a giant humanitarian crisis. And I think we can really refer to the large body of evidence from other humanitarian crises to understand what's happening in India at the moment. And I'd really say there are two broad issues that we should consider. What's happening at the level of the entire population, the sweeping anxiety and fear, for example, of contracting the infection. And more importantly, that is twinned with the sense of, the usual comfort we have on people we trust collapsing around us. And then you have a specific subgroups in this population who have disproportionately been affected by the pandemic, and I'm sure we'll talk about them, but just to flag them up, first of all, we must acknowledge the unique needs of people who survived COVID, particularly those who have had acute respiratory problems or had essentially been put on a ventilator. The second is young people who have been blocked out of their schools for more than a year now. And the third is women who have found themselves in a very patriarchal society, locked into their homes, not only having to deal with work, but also with their kids and with other domestic responsibilities. And finally, let us also not forget people who had pre-existing mental health problems, because this is a group that we now know from evidence in other parts of the world are 2 to 3 times more likely to die when they have COVID, just in the same way that we see with other chronic diseases.
Dr. Sameer Parekh, what are the symptoms that you think, or the indications that you think people should be looking out for in their near and dear ones? Because it's not just people with known histories of mental illness. This could be just about anyone who till the other day had no known mental issues, who's suddenly starting to sink because of the anxiety, the fear, the frustration, the looming threat of death. What are you making of the impact that this round of infections is having on people's health, and what do you think others should be looking out for in people around them?
See, Rahul, one thing we must understand that 1 in 5 people in the world have been suffering from a mental illness in any case. So that data, that statistic was a reality of our times in any case. Now what has happened now is that an unprecedented, completely something that we can't relate to, can't adapt so easily, has hit us and hit us hard, and it's affected us across the board. Like today, if you would talk to any individual, especially in affected areas, it's virtually impossible that they would have not had a direct experience, which is a family friend or a colleague. Now that's something that is very significant. What that does is it brings you an anxiety. The most basic anxiety, would I be fine? Would my family be fine? And then that starts playing on your mind because of the data, the news, the numbers, the false narratives, social media. Then you add on the entire work from home, add on to the fact that there is this fear of isolation and quarantine, then the whole fear about what if I get a bed, what if the illness happens in a way that I might not get the treatment. All of that is almost creating a panic-like situation which all of us at some degree or the other are in. So it could be you, it could be me. We are all going through that. As we speak, I'm in quarantine, close family member is COVID positive. The constant fear is there. What is next? Now, in this time, what we need to look for is, let's say, sleep issues, restlessness, mood swings, not eating on time or avoiding it, avoiding work, not wanting to talk to people, feeling restless, panicky, over preoccupation with social media and numbers, almost like being preoccupied about the illness, not being able to continue with normal functioning of life. Any of this happening, talk to the individual. See, I've always believed expertization is not going to be the solution for mental health in our country for a long time. We don't have that many experts. We need to go to the most basic level support systems. We need our support systems, family, colleagues, neighbors, RWAs on track, more communication, more time spending, and accept anxiety as a normal human response. And are human beings facing an unbelievable, unprecedented devastation. We are bound to react. So if you feel anxious, but as normal as it gets, accept it, work on it. And I think that's the kind of approach we need to have, both acceptance and doing something about it.
Dr. Amit Sen, you work a lot with children and adolescents. We're looking at the impact this is having on adults. And I know several colleagues around me have come up and spoken of mental health issues, how they're taking counseling, much more than I've ever dealt with in my 2 decades of being in journalism. But what about young kids and adolescents and the impact that you think being locked up at home, unable to meet their friends, unable to go to school or college is having on our young generation, and how should we as parents be dealing with that?
Well, to start with, I think it's important to make note of the fact, when it comes to child mental health, we often have a blind spot. We don't seem to see it. And some of the reasons could be that we don't want to acknowledge that as a society, as a community, as a family, we could do things or make choices which could make the mental health and well-being of our children, come under strain and they suffering from something which is emotional or mental. It's very hard for a society or a community to accept, right? The second thing that could be is that a lot of the mental health problems in children particularly, and even in adolescents, show up as behavior difficulties. It could come up as temper tantrums, oppositional defiant behaviors. It could come as huge mood swings, rebellion. It could show in the form of substance misuse. It could, children, when they're really distressed, could gravitate towards different forms of screen and technical devices. And those then come problematic behaviors rather than mental health problems. And that's when both parents and schools and the larger community begins to treat them as a behavioral issue. And rather than show compassion or connect to the undercurrents of emotional distress the child might be going through, they start the behaviors and try to discipline them and try to make boundaries. And that makes it much worse. Indeed, in this lockdown, in the beginning, we had so many families who got very busy with, firefighting with the logistical and the financial issues. And indeed, so many of them decided that they don't want mental services for a while. And we also started getting reports that many families and young people were really thrilled to have a time off from colleges, and even parents who were working from home felt that this together is wonderful for bonding and family time and so on, right? However, within 2 to 4 weeks' time, they started coming back to us with such anguish, and everything was hitting the roof because sleep cycles were becoming, completely awry. The kids were constantly demanding fast food. They couldn't anymore stand the proximity and the togetherness that they were feeling happy about at one time. And there were slamming doors and temper tantrums and conflicts that started happening. And of course, besides, of course, the logistical the logistical changes, breakdown of the routines of daily living and the structure that holds children. It's so important. Many times till the time something is broken, we don't quite realize the value of it. And the mundane things like going to school, coming back, doing their homework, going, in the park, connecting with cousins in the weekends, these structures actually hold children together. And when that broke, then there was a huge amount of frustration and helplessness as a result. And then, of course, there was institutional background. A breakdown. For instance, schools had closed and offices were shut and all that. Transport systems were closed, and that had a huge impact on families. The thing to remember is that when families get affected, when there is anxiety in the air and everybody in the family, parents, grandparents are fearful and they have huge uncertainties in their hands, then that begins to affect the children as well. So we saw all kinds of symptoms, from younger children who had behavioral issues to the older ones who felt isolated. Many young people who were in the position of going to college or were working in their fledgling jobs lost them. And many of them could not return home at that time, And those kids were full of loneliness and battling with fears that were real and imagined. And even the ones who were so-called well-adjusted and successful before the COVID hit were seen to be struggling with the demons and, the trying to, grapple and hold on to the shreds of hopes that were slipping away from their fingers.
But Dr. Barmi, how should parents be dealing with this situation? Because, the parents themselves are going through huge mental health issues at work, amongst their friends, with their own parents, with society, and yet you've got to look out for children who are at home. I know of many cases where mothers and fathers have simply had it with their children. They want the children out of home, but the fact is that the children can't go anywhere, and it's just building to a negative atmosphere at home. What are you picking up in terms of the mental health issues that this COVID pandemic is having?
Rahul, let me start by congratulating you as always of picking up something very, very sensitive as a topic. I think COVID as a pandemic and mental health as an epidemic is just becoming hand in glove. And I'm very glad that we're all here as a panel discussing this and bringing this to sensitive awareness of all of us. I think our panel has already discussed what are some of the things that we need to be sensitively vigilant about. And I think very important it is, number one, for parents to be sensitively vigilant to what their child is going through. I think there are certain signals that the children are giving, even if they're not able to express. And we as adults, we as parents to those children and even young adolescents need to be vigilant, because sometimes it is not coming as openly as what the mature adult can express. So certain signals, like even on physiological changes, when the sleep pattern is getting disturbed, one needs to be cautious. When the appetite pattern is getting disturbed, one needs to be cautious. When there are more bodily aches and pains without any physical reason, one needs to be sensitive. When a child says, I'm not able to focus, my forgetfulness is increasing, I'm brooding more, I'm procrastinating, one needs to be sensitive. And emotionally identify what is happening in the lives. In the lives, usually a lot of children are either internalizing their stress in terms of going into a gamut of maybe sadness, feeling low, having negative thoughts, ideas of helplessness, hopelessness, getting into the anxiety gamut of apprehensions, what is going to happen in the future, are my schools opening, not opening, are my exams happening, the boards, the competitive exams, everything's kind of just postponed and burnout is happening. Am I going to meet up with my friends? Am I going to meet up with my peers? Am I going to be available for my teachers? So either the children are internalizing, which parents need to be aware of, or they're also externalizing. Externalizing in terms of either their ADHD, the attention deficit hyperactivity, is becoming higher, or they're also becoming irritable, short-tempered, angry, displacing their anger. So as an adult parent, I think never before would we need to be so vigilant than now.
Okay, Dr. Patel, I want to focus for a moment on the individual. Now, people are seeing more death, more anxiety than they've ever seen, and probably more than people will need to see in generations. Forget trying to take care of your children or your parents or your friends for a moment. How should individuals be dealing with this? Because, you've got people calling you saying, help me get admitted to a hospital, my relative is dying, oxygen levels are slipping, there are no beds available. It's the kind of situation which is just, aggravating mental health issues. So how should individuals just try to keep themselves sane in the midst of all of what's happening around us? What are your thoughts there?
I think the first thing to do is not to pathologize the way we are feeling. I think it's really important to understand that in a humanitarian crisis like this, the last thing you want to do is to medicalize this whole experience. This is a completely normative human reaction to an unimaginable disaster that has faced the country. So let's stop medicalizing the situation. That's the start. acknowledging that these experiences of distress are what any human being put in these circumstances would experience. That's the first thing to say, to normalize this experience. The second thing I'd say is that, we've heard of all the different techniques that from some of the other panelists, such as, for example, establishing a routine, etc., which one can do to promote one's own well-being and to protect oneself from these uncertainties. But I want to add a couple of other things. I think it's extremely important to turn this crisis into an opportunity to reach out to others. We know now from the science of compassion that actually caring for others, supporting others, being engaged in a purposeful and meaningful way in the context of a humanitarian crisis is one of the most powerful ways to promote your own well-being and mental health. Not least because it helps distract from your own anxiety, but also because by getting a sense of purpose and meaning, you actually help rebuild your own sense of confidence and trust in the future. So I would strongly recommend that. But hopefully, I think, Rahul, you will also ask questions about what can we do at the whole population level that can help reduce the rise in anxiety and fear that other panelists have spoken about across the country.
Okay, so why don't you answer that question in just a bit. Let me first go across to Dr. Parikh on what individuals can do. They're watching TV, they're doom scrolling on their Twitter or Facebook accounts, seeing how their world is literally collapsing around them. How do you just stay sane through this?
Not easy, Rahul. Not easy for me. And I must really repeat what Vikram just said. Let's understand what we are going through is normal. When you have a fire in your house, you can't look at what your diagnosis is or not. You are supposed to feel anxious. Then you figure out what to do, but you recognize the fire, accept the fear, and now try to douse it. I have been talking about this for the past few days, COVID-appropriate behavior, but I'll give you the psychological version of it, picking up from what Vikram also said. Compassion is COVID-appropriate behavior. You bring compassion for yourself and others, that will bring you positivity, and that's the second COVID-appropriate behavior, stay positive. There is so much of negativity around us. How do you douse it? How do you drown it? You can't drown it by cognitively clearing it. You bombard it with positivity. How will you get positivity? Social connectedness. We are still living in a time where almost everybody has a phone in their hands. Imagine if this would have happened 50, 60 years back. Imagine the sheer size of isolation and depth of loneliness one would have gone through. So utilize that. I'm aware of alumni and friends and distant families reconnecting to themselves and finding their roots. We've always been an interdependent, connected culture. You go back to that. So, yes, you take care of your routine. Most importantly, don't bottle it up. Unmute yourself is what I've been telling people. But accept this. It's okay to be anxious when there is so much of despair and devastation around. So, expertization, like I said earlier, is not the solution. It is the human component which is the solution. So we don't need to right now think about what next. Right now we think about what now. What now? You take care of you, I take care of me, we take care of each other, but we also make sure empathy, altruism, some of the basic values of mankind are so important. And that's what you use that as an opportunity. I've been telling this, schools should talk about values. Look at the inspirational stories. Look at the way healthcare workers are working. Look at how frontline people have been working. Be inspired, share inspiration, and keep looking at positive stories, like how your channel comes about every day with a good news story. We need a good news story every hour, Rahul, because bad news is just all around us. So accept it, and then do the next step, but together. This is not about an I. It's only about we. The moment we's will be lost in the I's will not be able to function. Not possible. A pandemic is a mammoth experience for mankind. So the we needs to be stronger. I needs to be lost somewhere.
Dr. Amit Sen, your ideas for individuals to deal with the pandemic and to stay sane and sober as we see the world collapse around us?
Yeah, so to start with, I think I would absolutely, resonate with what Vikram was saying in terms of normalizing this experience and also accepting it, as Sameer was saying. Indeed, it is, both these things are extremely important to understand that what we're experiencing at this time is a kind of a disaster that is unprecedented. Many people have likened it to a tsunami or an earthquake, but those are finite. They come and go, and there is an aftermath we have to deal with. This creature doesn't seem to go away at all. It's relentless. It's like a endemic war zone, but global, completely, reaching every corner of the world. And the kind of breakdown of faith and trust and hope that happens repeatedly every time with every announcement that happens is very hard to deal with. So that's the first thing, accepting it and knowing that it is difficult and saying it to each other. The second thing, there are things that I've been talking about to families and children about how to deal with it in their own selves and in the family. So the first thing is to get back a semblance of the routine, right? And to be able to do that, I often encourage children, and especially if they're a little older, adolescents and parents and family, to sit together and figure out different roles. Like your role as a student has changed because you're homeschooling, or your role as a breadwinner or a homemaker has changed completely. So how do you want to do that and have an open discussion on it? Similar to that, have a discussion on what kind of responsibilities you can take in the family, because a lot of the times the domestic help are not there. So how do you contribute there? And lastly, of course, how do you contribute to the family? And then have a discussion, think about a loose structure for each one, which is flexible, and start with that. The second thing I often talk about is the sense of belongingness and meaning that we have to get back into our lives, because that has gone away. And some of what both Vikram about in terms of attaching yourself to values and digging back into what had made you as a person, which gives you a sense of identity and belongingness, is so important. See, the future has been snatched away from us. There's so much of uncertainty and lack of hope that despair is the natural response to it. So where do we go from there? Because hope often pulls us, isn't it? Hope keeps us going. But if we don't have hope, then we have the here and now, and we have our past experiences. And if you dig into that, the motives at home, whether they be old albums, DVDs that are collecting dust, books that you used to read to your children, dig them out and make those stories again. And the third thing that I often talk about are things, are questioning the given. This is a fantastic opportunity to help us reflect on what we have done to our earth, to the environment. What is the definition of success after all? And what are the institutions that contribute to it? And question these givens, the institutions, and how we can change the, actually create a new normal, and indeed look at the role of mental health in all this. And again, as every other panelist has thanked you, I think this is a fabulous opportunity to discuss how, and I hope many people are listening to this, that mental health needs to come to a space in our existence where it is given its due, because it's going to have a huge impact on how this crisis unfolds. We know that the trauma can be long lasting, and it can unfold over years and decades, lifetime sometimes, right? And if we are not able to address that right now, it's so hard to imagine how humanity will look like.
And Dr. Burmi, it's not just the common people who have non-medical lives, but even take doctors, for example. They're now seeing more death and devastation, like in the morning, and which is where the idea for this broadcast came from. One of the top doctors told me about how his ICU doctors and doctors inside ICU are used to seeing death every single day virtually. They collapsed of exhaustion and mental fatigue because they just couldn't take it any longer, because they saw 3 young kids, relatively young kids, 20 to 30, in a quick span of time, just in about 7 minutes, collapse in front of their eyes. And these were people who were perfectly healthy, and they just packed up. And these are people who've seen death much more than any of us, because we're not used to seeing death in quite the way that a doctor or medical staff is, and they're not being able to deal with this.
Absolutely, Rahul. I think it's a very, very unfortunate state of affairs where the frontline and the doctors are really facing the real brunt of it, and it is not easy. And I extend my heartfelt respect and salute to each person standing there very, very strong. And I think as a doctor, we need to start respecting ourselves even more than ever before. And we need to actually empower ourselves and use this as an opportunity to actually realize what the actual worth of life is. and how important my role is in being able to bring that life to real time at this point of time. I think even in terms of the medical fraternity, I would really encourage them to maintain a balance so that they can keep empowering themselves. The amount of quantity of time that they're spending in bringing lives back, a part of their life should also be spent in rejuvenating their own selves. So, for instance, a lot of us on the panel have been talking about what individuals can do. I think doctors also should consider them a part of that individual race and empower themselves with a lot of these things that are being spoken about. And especially they don't have quantity of time, but the quality of time that they have, if they can manage that for certain things that bring pleasure in their life, it will be very, very good. Additional.
Go on, complete what you're saying.
Additional to that, I think the kind of values that they can inculcate, in which if they can assess the attitude of unconditional giving, because this is exactly what they're doing. And whenever the hand is up, we must understand that psychologically we are empowered, and there is much more contentment and satisfaction than we are at the receiving end. So right now, the medical fraternity is in a position of unconditional giving, and that is a gratitude that the entire nation, the entire world is giving back to
Dr.
them.
Patel, you spoke about what individuals should do. You also wanted to speak before we end about what society as a collective, as a population should be doing. So how should people as a collective be trying to deal with this pandemic's mental health aspects?
Thanks, Rahul. That's something which is, I think, very important, because we're not going to be able to deal with this one person by another. You know, this is a 1.4 billion people affected. And as Amit has said, in fact, the whole world has been affected to some degree or the other. We have to look at statewide, population-wide responses. And let's just first of all acknowledge that each of us, our mental health relies on certain foundations. One of them is certainty about what the future holds. Another is knowing that other people stand with you. And the third is trust in people in authority. And I think each of these offers us ways of thinking about how the state can respond to the population-wide mental health difficulties that we're experiencing. Of course, the pandemic and the state response has disrupted all of these at the moment. Even things we took for granted, like just having a simple meeting with your friends, or that you could rely on the government to be prepared to ensure that oxygen was supplied, are no longer certain. So let me just suggest a few key things that I believe the state should do immediately. The first is it must work towards rebuilding trust in our country. And to do so, it has to be transparent with the facts. It has to communicate, no matter if those facts are difficult. But the more that there is a dissonance in our country about facts, the more the trust harm, the deficit grows, and the worse is the mental health impact. Secondly, I think there is no agency better than the government to coordinate efforts in the community. There are thousands, if not hundreds and thousands, of civil society organizations and individuals who are doing incredible work. They need support, they need financing, they need coordination. The government should not see this as an enemy or as some kind of alternative sector. We must stand together, shoulder to shoulder, civil society, critics, and the state. This is not the time for political and partisan differences. And finally, I believe that we must plan for high-risk groups. We've heard about some. Let us not please forget those who've survived COVID, particularly those who've had acute complications. We know that they will have much higher mental health needs in the weeks and months ahead. And equally, let us not forget those who've been bereaved because someone in their families have died due to COVID.
You know, we've had a very insightful conversation. There are no perfect, clean, clear answers here, but there's a lot to take away from this chat, and there's a lot to reflect on. And I think the key takeaway from my perspective is don't close your mind to the idea that you won't have a mental health issue, because no matter how strong you think you are, no matter how much you think you're in control, this is a situation where no one is truly in control. So, you know, be more aware of how you're feeling, talk and listen to these doctors and the advice that they've given you. And hopefully, together and individually, we will live to fight another day. Dr. Patel, Dr. Sen, Dr. Parikh and Bhavna Barmi for joining me on this broadcast. Thank you. You're on board the Newstrack. Delhi's healthcare system has completely collapsed, with hospitals denying entry to patients. Hundreds of people are dying in ambulances, and the ambulance staff is way overburdened. My colleague Preeti Chaudhary took to the roads to get you a report on a day in the life of an ambulance driver.
It is a wail of a city that should forever burn into the conscience of this country. A wail so deafening, and cutting through that wail is the screech of this siren. It's this ambulance that has come to be the poster child, or the insignia, if one might call it, of this pandemic in Delhi. That's all you see, an ambulance tearing through the roads of the national capital. Driving that eerie narrative are these men, overworked, underpaid, ill-equipped in gear to fight the virus, some being accused of overcharging, but all completely numb.
मेरी भी मम्मी 21 तारीख को एक्सपायर हुई है। 21 तारीख को मम्मी सपने में आई कि बेटा सेवा मत छोड़ियो, जो तू सेवा कर रहा है ना, ये सेवा करते रहियो, इस सेवा में मिलेगी।
हाँ, पिछली बार से तो बहुत ज्यादा निकल रही है।
आपको डर लगता है खुद?
अब डर क्या लगेगा जी, हमें भी तो एक दिन ही जाना ही है, उसमें डरना क्या। अब देखो ये डरने से बच्चे तो पलेंगे नहीं।
Few are now driving ambulances after being laid off during the lockdown. Adesh is one of them, now attached as a driver with the disaster response team with the government.
तो लॉकडाउन में मेरी मैम जॉब चली गई, तो मैं दोबारा फिर वापस सर के पास आ गया। तो अभी काफी 3-4 महीनों से मैं यहीं पर सेवा दे रहा हूँ मैम। दिन का हमारा मैम सुबह मॉर्निंग से 6 बजे से स्टार्ट हो जाता है, और बस मैम अब ये नहीं पता होता कि रात कब होगी मैम।
मदद करनी पड़ती है?
मदद करनी पड़ती है मैम। मोर्चरी के बैग के अंदर मैम उनको डिस्पोज करना पड़ता है मैम, क्लोज करना पड़ता है, और हाथ भी लगाना पड़ता है। कोई फैमिली साथ नहीं देती है।
आपकी फैमिली है?
हाँ, मेरी फैमिली है मैम, मेरे 2 बच्चे हैं मैम।
डर लगता है?
डर लगता है मैम, घर नहीं जाता मैम, 3 महीने से घर नहीं गया मैम।
Their phones have been ringing. A call has come, not for a hospital run, but to pick a body from home. A COVID death, but unaccounted, like so many more. A family in shock, a COVID body zipped in a body bag, carried down, the last goodbye. A stunned people watch with folded hands as a pandemic stalks, preying on what terrifies us most, suffering alone, dying alone, and even walking that proverbial path to moksha alone, with the help of not a loved one, but a few good, very good men. Reporting with video journalist Hitesh Kumar, Preeti Chaudhary in Delhi for India Today.
Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.